So how do we correct neuropathy? Well, this is where the excitement comes in. We use a few tools, and we base these tools based on your exam, your evaluation, and your x-rays. The chiropractic care, the adjustments, the decompression, based on low back spinal alignment, if the discs are degenerating. So that's a different component as we add in the home therapy. And so we use some really exciting stuff. The Rebuilder is a nerve, rebuilding the nerve flow. It's why it's called the Rebuilder. So it retraces the nerve flow from the low back, from the spinal cord, out through the back, the legs, all the way to the feet. This is not a TENS unit. This is not just to stimulate. This is to heal. How we do this is they're applied to a pad, and these pads are the conductors. When we put it in the water, each side will have its foot being put in. That conducts the energy. That conducts the healing. It's very comfortable and very easy to do. Second is we use an Anodyne light therapy. This, you put the bottom of your foot, you put your foot in here, it goes on the bottom of your foot. This you put around your calf. Now this is an 890 nanometer light therapy, UV light. So you don't see the light therapy when you turn it on because of the intensity, the high level. Most UV lights out there, you know, are anywhere 300, 400 or less, so they don't penetrate the body for the circulation. Again, very easy to do. There's no pain, no sensation on any of the tests. Very easy to apply. So with the tools from the chiropractic part to the light therapy to the nerve rebuilder and some home supplements to increase nitric oxide to draw that circulation down into the foot, we get an amazing level of success. About a 90-95% success rate. Our patients are seeing results very quickly, sometimes within a few visits to a few weeks, and then their problems start to reverse. So one patient, when she first got tested, she was at a level 60 to 65% damage, loss of nerve flow into her legs. Very little sensation when I did the testing. At her first 90-day mark, she was down to 30 and 34% loss. So nearly cut it in half. She was feeling the sensation, she was walking better, and knew her body was healing. At the next 90-day testing, she went all the way down to 17 and 14%, which 20% and more, after your body has 20% damage, your body's breaking down faster than it can heal. Once you get to 80-85%, it almost becomes permanent. It's very hard to reverse that, so that's why we do the testing to determine that. And then the home therapy and the therapy we do in our office is all based on your specific needs if you have neuropathy and if we can help you. Very exciting, new technology that is just really killing it.